SpineDex back system is nationally recognized as an alternative treatment to spine surgery. And here to tell us more about it is Dr. Thomas Blankenbaker and two of his patients, Lisa Dow and Scott Childress. Thank you for joining us, everybody. Doctor, I first want to talk with you. Tell us, what is SpineDex?
SpineDex is an acronym that stands for spine decompression and exercise.
Okay.
So basically we've got computerized technology that we strengthen the muscles of the spine, and computerized technology whereas we decompress herniated or bulging discs.
So are those the kind of patients that would benefit from this, disc issues?
It is. Most of our patients have herniated disc, bulging discs, degenerative disc disease,
Yes.
and they have sciatic leg pain or numbness and tingling in their hands and arms.
I want to talk with Scott and Lisa real quick. Lisa, is that kind of what you were experiencing?
Absolutely. I was diagnosed with a herniated disc in my lower back, and as a result had horrible sciatic pain, could not function in either of my jobs, and Dr. Blankenbaker was able to save me essentially with this treatment.
Did doctors try to persuade you to do surgery?
Absolutely. In fact, the medical doctor that I went to, which is a common practice, they typically right away want to send you to a pain management center where they give you the shots in the back, and I have known several people that have done that with no success. I wasn't a fan of shots, but...
Gotcha. I understand.
Yes.
I understand that. Those are the two other things we hear about quite frequently. Same thing with you, Scott? Similar story?
Yeah, very similar experience. I mean, mine was so severe that when I showed up at Dr. B's office, as I finally referred to him, I couldn't even walk. I mean, I felt like my entire back was completely paralyzed. And then after going through the decompression machines and then going through regular exercise and therapy with his office, I'm back to normal. So, you know, it's the best way to go as far as I'm concerned.
Wow. Now, can this be used for folks who have, like, personal injury issues or injured workers?
Yes, it is approved for injured workers and also personal injury. You know, seat belts save lives, but they do cause injury to the spine. So a lot of people that are in car crashes have herniated discs or bulging discs in their spine after the crash.
Now, once they're treated, like Scott and Lisa, what happens? Do they have to have multiple? Do they go back for more treatments? Is it cured?
Well, our treatment is generally over 4 to 6 week period, at which time hopefully they're asymptomatic, and then some people choose to come back for maintenance care, others don't. So it just kind of depends on the individual.
Can you tell us real quick? I know you should brought a little. How does this work? Because I mean, to not have to do surgery, which everyone will tell you if you can avoid that, that's always a good thing.
That's correct. You can see here, this is an anatomical model of the spine. These are the bumps you feel on your back, and then these are the spinal nerves that come out right here. And as you can see, there's a crack in the upper corner of the disc. Those cracks often lead to what we call a herniated or a bulging disc, whereas you can actually see how the bulge presses against the nerve root.
Right here?
Yeah, if you can see that.
Yeah, what's that leaking out there?
That's the part of the disc material that presses against the nerve root.
And that shoots that pain down, right?
Down your leg.
Oh, yeah, I know.
And there's some 300,000 nerves in each one of these nerve roots, and they travel approximately 300 miles an hour.
I got
So you can see how having a bulged disc or a herniated disc in your spine would cause all kinds of problems down your legs or down your arms if it was in your neck.
Wow, so you're able to go ahead and treat it without surgery, without shots. You can basically make the spine stronger again.
Yes, we do. We have computerized equipment that actually decompresses the disc non-surgically. We create a negative vacuum in the center of the disc, which actually draws the disc material back into the disc.
And how long have you been using this system?
I've been in practice 37 years. The last 15 years I've been developing this system, and it is nationally recognized, and we get 8 out of 10 people completely better.
Wow, that's great news. Thank you so much for sharing that. It's great information, and I'm glad to see both of you smiling and walking with no pain.
Us too.
Yeah, us too. Thank you very much, Doctor. Thank you, Scott and Lisa. So if you'd like more information on SpineDex back system, very simple, go to spinedex.com, or you can call the phone number you see right there on your screen and make that appointment.